so hello dears, it's Ayan and welcome back. Welcome back. Oh, welcome back. Welcome back again to the continuation of our pre-recorded lecture on viral hepatitis serology. And for this video, what we're going to start now is your first primary hepatitis virus, and that is your Hepatitis A. Alright, so for Hepatitis A infection, of course, the etiology, the causative agent is of course, nasa pangalan na, your Hepatitis A virus. And this Hepatitis A virus is non-enveloped, single-stranded RNA virus of the hepatovirus genus of the picoRNA viridae family. Ayan. So, I pronounce it differently, or maybe you pronounce it that way, so good. But before, when I was still a third-year student, I pronounced it as picorna viridae family. But then Sir Jamu, yes, my lord, my idol, he taught us, or he shared to us how he pronounced it, and that is picoRNA viridae family. So it makes much more sense, okay? Because it's pag pronounce pa lang daan, I already know na okay, it's an RNA virus kasi nasa pangalan na picoRNA viridae family. And pico or pico is like a prefix, diba? Parang to indicate size. I think 10 to the negative 15 ba, if I'm not mistaken. But yeah, diba? So kaysa naman mention ko picorna viridae, diba? So I mean, I don't know the correct pronunciation, but that's how I pronounce, and I'm sharing it to you because that's what Sir Jem taught us, okay? So that again, it would help you also identify na, okay, sa pangalan pa lang, I already know that it is an RNA virus, o diba? So, pico RNA viridae family, ayan. So, picoRNA viridae family, and daming chika, mga tips lang naman. O diba yung mga pag-grammar, pronunciation dito? Yes, ESL mali ay, charot. Okay, alright. Ayan, so picoRNA viridae family, replication of the virus happens in the cytoplasm of the hepatocyte, and it is considered to be the only hepatitis virus that has been successfully grown in culture. Ayan, because the remaining of your hepatitis viruses are, I think, quite difficult to grow in culture, but it's only hepatitis A, nako, ayan, the only virus that has been successfully grown in culture. Ayan, okay. Alright, ayan. And lastly, high titers detected in acute phase stool samples. So there are high titers that can be seen in the stool samples. Okay. Alright, so why in stool samples? Okay, so we go down to its epidemiology. Its old name is called infectious hepatitis, or short incubation hepatitis. It's primarily a disease of young children in developing countries because, kasi ang primary mode of transmission, it's transmitted by fecal-oral. Ayan. So, fecal-oral route by close person-to-person contact or ingestion of contaminated food or water. So, I'm sure, mga review na lang sa inyong virology, diba? So, hopefully, na-remember pang viro. Okay. But yeah, it was formerly called infectious hepatitis, primarily because of this reason. It can be transmitted through fecal-oral, so pas-pas siya ma-transmit. Okay? Food and water pag yun. And its short incubation we'll know later. Okay, but the primary mode of transmission is fecal-oral. Okay, so it's through mga contaminated food and water. Alright, that's why the children are much more vulnerable, especially in developing countries, because your developing countries usually they have poor sanitation, improper mga waste disposal and all that. So therefore, the chances of having contaminated food and water are high. Okay, so the developing countries are much more prone to this, okay, to this disease. Alright, ayan. So again, mode of transmission, fecal-oral route. Okay, alright, so it's only fecal-oral, okay, but human infectivity in urine and saliva for hepatitis A, they do not pose a significant risk. Okay, so walay risk kaayo of urine or saliva for hepatitis A. Okay, alright, so it's mostly sa feces, fecal-oral. Okay, alright. It has also been suggested that sexual contact may play a role, but it's not common. Okay, possible lang siya, but it's not common. Okay, mujri siya ang primary mode of transmission, the fecal-oral. Okay, alright. Ayan. For signs and symptoms, incubation period, as you can see, it's about 15 to 45 days, average of about 28 days. The virus produces symptoms of acute hepatitis in the majority of infected adults 2 to 6 weeks after exposure. And most infection in children are asymptomatic, but the good thing lang for hepatitis A is that it does not progress to chronic forms. It's self-limiting. Meaning, when you say self-limiting, it can resolve on its own within a few months. So, yung treatment lang anak for the patient is supportive, bed rest, eat healthy food, mga vitamins, whatever. Basta pa-boost lang sa immune system. But it does not progress to chronic forms, which is a good thing. Okay, it's self-limiting. Ma-okay ra ka within 2 months. Okay, so, but it does not mean na magpa-hepatitis A po ka ha. Always protect yourself. Okay, always be careful with the food you eat. Okay, alright. Ayan. And hepatitis A also is, yung infection is anicteric. Ano ba? Wow, ang ganda ng whiteboard marker, it's so new. Charot. Okay. Anicteric meaning it does not produce any jaundice or it does not produce any symptoms that could point na, hepatitis na siya. Okay, so, wala siya. For many of the patients experiencing hepatitis A. Okay, but again, very important thing, it does not progress to chronic form. So, the chances of having mga hepatocellular carcinoma or liver cirrhosis, liver necrosis is not high for hepatitis A. Okay, because again, it's self-limiting, it can be resolved within a few months. Okay, within 2 months. Ayan. Okay. Alright. Okay, now we go now to the immunologic manifestations of your disease. Your antigens for the hepatitis A virus are shed in the feces of infected individuals during the incubation period and the early acute stage of infection. So during the incubation period, meaning the first time na na-expose ka to the appearance of symptoms. So kana siya na period na wala kayo na feel pero na-expose na di ay ka. Ayan, that's the incubation period. I'd like to think about it as if it's as something, a period na nagpadaghan pa ang virus. Okay, nagpadaghan pa siya para mabot ang level na niya itong level na makapa-infect na siya or maka-cause na siya of symptoms or disease. Ganun. That's how I like to think about incubation period. Okay, alright. And again, early acute stage. So early acute na naka-infection pero early pa lang. Okay. Alright. And shortly after the onset of your fecal shedding of the antigens, of course, the first antibody to be produced is primary response IgM. And then, of course, after a while is your IgG within a few days. Okay. Alright. Ayan. Now, we go now to IgM. Again, anti-HAV, anti-HAV, always detectable in patients with acute. And, of course, IgG, manifestation of immunity. Okay. Peaks after the acute illness and remains detectable indefinitely, perhaps lifelong. Okay. Alright. And we also have what we call Alright. You have the total HAV antibodies, diba? So total HAV, basta total HAV gani, it means IgG na concentration and IgM. Okay. Alright, so if ever man gani nahuman na, okay, nahuman ang infection, okay, tapos nagpa-test ka, example, negative imuhang IgM na have antibody, pero positive imuhang total have na antibody, okay? So that could indicate that, di ba? Negative naman ang IgM, pero positive ang total. It means that you already have the IgG. Kaya di ba, ang total have, combine man ang duha na concentration. So if positive ka sa total have, pero negative yung IgM, it could mean that you have the IgG, have antibody, and that you are already immune. You have already immunity to HAV, hepatitis A virus. Okay. Alright, ayan. So I hope na-gets that. Okay. Alright. Now for laboratory, where do we come into the picture, chart? As a laboratory personnel or as the lab, the main approach is of course serologic tests, RIA, radioimmunoassay, and ELISA. Okay, very accurate. Your labeled immunoassays to detect the presence of specific HAV antibodies. So again, for IgM, it's usually solid phase antibody capture ELISA. So yung solid phase na ay antibodies that will capture the antibodies. Mura siyang sandwich, di ba? Pero siya, antibodies ang nasa solid phase, tapos i-capture niya itong antibodies sa inyong serum, parang ganun. Okay, and ang IgG is competitive inhibition ELISA. So same siya o principles sa agglutination inhibition, I think, if I'm not mistaken. And I think I-mention natin yung competitive inhibition ELISA. Basta yes, for IgG anti-HAV. And kabati mo, we do not test for your antigens. They are not clinical useful. They're not useful indicators for the disease because your HAV antigens, they decrease after the onset of symptoms. Okay? So paggawa sa symptoms, ang antigens po sa HAV, sa imong hepatitis A virus in the feces, will decrease. So dili na siya ma-detect. Okay? So we don't test for the Have antigens, primarily for that reason. Okay, because again, they are not useful clinical indicators. Okay, alright. And other available tests, of course, are molecular tests for RT-PCR. Basta ganyan mga RNA virus tests usually, if you want to perform molecular tests, we usually go for reverse transcriptase PCR. Because again, we want to convert muna RNA to DNA para mas ma-amplify siya. Parang ganun. Ayan, again, medyo weak shit ko. So, yes, namalikas. Weak ko yung mga molecular tests, diagnostics. So, I'm sure you're much more knowledgeable when it comes to this. So, kamo na akong, kamo rin siya bahala or like, mag-hands down ako ninyo. Okay? Because again, akong knowledge of molecular diagnostics very poor, very little. So, I need to study pa yun. Okay, apologies naman. Alright, ayan. So, that's for hepatitis A. Ayan. So, sa mga gusto, palagi kumakain ng street food, yes, like me, charot. Gusto na street food dyan, chef's kiss, okay. Always make sure lang yun that it's clean. How will you guarantee its cleanliness? No? But anyway, basta self-limiting bitaw ng hepatitis A. Muna siya, if mga street food sa mga friends, dito sa Norsu, yes. Like sa Gate 7, mula ba, Norsu, alam niya, my gosh, I miss. Anyway, but yeah, so if makakabay kayo muna, yes, hepatitis A, welcome. Okay. Yeah, so just make sure that it's clean and that your immune system is really strong, okay? And again, if ever magaling self-limiting ng hepatitis A, okay? Ayan, anyway, sige lang, let's not wish that you have that, no? So, palayo lang yun. But sa mga ganang street food dyan, the best yun, okay? Mga ulit ang street food, guys, and Norsu. O magbalik ng face-to-face. Sana naman, okay? Ayan, anyway, that's for hepatitis A. Okay, the next hepatitis virus that we are going to discuss is your hepatitis E. Ayan, so for hepatitis E, it's also known as your waterborne hepatitis. The agent is, of course, hepatitis E virus, non-enveloped, single-stranded RNA virus pa rin, formerly from the Calliciviridae family, but it's now reclassified to Hepaviridae. Okay, the mode of transmission, as you can see, is fecal-oral. That's why I grouped the hepatitis A and hepatitis E together because they have the same mode of transmission. Fecal-oral. Okay, alright, ayan. Incubation period is about much longer than hepatitis A, about 6 weeks, okay? And yeah, that's for incubation period. For signs and symptoms, it can cause fulminant acute hepatitis, especially for pregnant women, and high mortality rate. It can cause death among pregnant women, but it cannot progress to chronic forms. It can progress to chronic forms for pregnant women pala, okay? Or it can be deadly for pregnant women. But generally, if you're not pregnant, okay, alright, or you're just a normal human being, like adolescent pa, there is no progression to chronic forms, okay? Alright, but muna siya yung remember sa hepatitis E. Hepatitis E, siya dyan ang naayla kung effect sa pregnant women. High mortality rate ay mga buros, mga pregnant women. Okay, alright. Lab DX, serologic is of course ELISA. We detect for your antibodies, okay, IgM, IgA, and IgG. So still the same interpretation, IgM acute, IgG past infection. For IgA, I'm not entirely sure kung asa siya ginatest, but I think for the pregnant women na basta silang secretions and all that. Okay, and for molecular is of course RT-PCR to detect the RNA of the virus. And lastly, if you want to, for high-end labs and good reference laboratories, we can perform immunoelectron microscopy for the detection of the virus itself in your stool samples. Okay, immunoelectron microscopy. But again, not commonly performed in routine laboratories. Very technical. Okay, alright, that's for hepatitis E virus, Hep. Okay, alright. Ayan, now we go now, so those are the two, di ba? Before we go there. So, mnemonics lang akong i-share. How do I remember? Ayan, nasa pangalan na. Ayan, hepatitis A and E can be transmitted through tae or fecal-oral, di ba? Hepatitis A and E can be transmitted fecal-orally or ma-transmit siya through tae. Okay. Sorry naman, pasitabi sa mga kumakain dyan, but yes, muna siya akong mnemonics for that. Okay, if you want to copy, go ahead. If you don't want, then kamo na po ibahala. Okay, wala ko namugos. Dili ka mamugos, so dili ganahan. Char! Okay, alright. So, just a mnemonic, tae. So, hepatitis A and E can be transmitted through tae, fecal-oral. Okay, so that's for the first two, hepatitis A and hepatitis E. Okay, now we go now to the next, which is your hepatitis C. So, kaning mga sunod sa hepatitis C, B, and D, ayan, medyo same din sila ang mode of transmission, di ba? ako na siyang i-group para at least makagets mo. Okay, or mas easy na. Okay, alright. Now for hepatitis C, ayan, the agent is known as, of course, hepatitis C virus or HCV. It's non-enveloped, spread single-stranded RNA virus of the Hepatitis C virus genus of what family? Flaviviridae. Ayan, so same family with your dengue virus, if I'm not mistaken. Yes, different genus lang, pero same family. Flaviviridae, dengue virus, your hepatitis C virus, HCV. You have 6 discovered genotypes, 1 through 6, okay? And over 50 different subtypes. Okay, ayan. So marami siyang mga check-up. Genotypes and subtypes. Okay. Now for epidemiology, it's formerly called non-A, non-B infectious hepatitis prior to the discovery of HCV. Because if I'm not mistaken, our first hepatitis virus na discover is hepatitis B, I think. Okay. And then next ang hepatitis A. If I'm not mistaken, ha? Alright. And then, pag discover na virus, of course, they don't know what to name it yet. So they called it non-A, non-B. Okay, alright. Ayan. So that's why it's now that's discovered, it's now hepatitis C. Okay. Hepatitis A, dears, diba, it was known as short incubation. Primarily because of incubation period is about 28 days lang. But in comparison to inyong hepatitis B, ang hepatitis B ang much longer ang incubation. If I'm not later, we'll know. Okay? Alright, that's why the hepatitis A is short incubation hepatitis. Okay. Daliman kong mention, naka-mention ko na, we'll know ano siyang short incubation. Muto siya. Okay? Alright, ayan. Sige, so balik na to hepatitis C. Hepatitis C, again, non-A, non-B. Okay, ayan first name. But now it's known as hepatitis C virus. And the main mode of transmission yun niya is blood transfusion or exposure to contaminated blood. That is why in the board exams, if ever maganda question, this hepatitis virus can be transmitted, primarily transmitted through blood transfusion. Then your answer, akong answer ana is hepatitis C virus. But actually, hepatitis B virus can also be transmitted through blood transfusion. So silang duha, C and B, can be transmitted through blood transfusion. But ang mas specific yun, like mugin ang main mudyo ang iyang mode of transmission, it's ang iyang mode of transmission yun, ang main mode of transmission niya is blood transfusion, then it's hepatitis C virus. Okay? Alright, I hope na gets lang. Alright, okay. Ayan, so exposure to contaminated blood. Other modes of transmission, parenteral, sexual, and even vertical. So, like mga parenteral, like through like mga needle stick injuries and other stuff. So, but yung main good primary mode of transmission is exposure to contaminated blood, especially blood transfusion. So, historically, the main transfusion, the main hepatitis virus that can be transmitted through transfusion is hepatitis C virus. But again, now, I think recent sources, major cause na karon sa transfusion sa hepatitis virus na ma-transmit sa transfusion is hepatitis B. Okay, but later we'll know that hepatitis B manggod, usually rare na siya ma-transmit sa blood transfusion, especially in mga developed countries because of the rigorous and extensive screening na good for blood donors and mga testing methods na ma-detect na good ang Hep B sa mga blood transfusion units or blood units. That's why rare na daw siya ma-transmit through blood transfusion, but it can still be transmitted through blood transfusion. Okay, so I hope na gets lang. Alright, ayan. Okay, so those are the modes of transmission. Now for the signs and symptoms, incubation period is much longer, average 7 weeks. Virus produces symptoms of acute hepatitis in about 20% of the cases, and majority are asymptomatic. So very scary, okay? Asymptomatic on most of those cases. Okay, you don't feel anything, but you have the virus pala. Alright. And it can progress to a chronic state in about 85% of the cases and can slowly lead to cirrhosis and even liver cancer or hepatocellular carcinoma. So siya first na virus na pwedeng progress to chronic forms, which can lead to cirrhosis and liver cancer. Okay, now for diagnostic evaluation, viral culture is difficult. So viral detection is made through serological methods and other laboratory methods. So for serological testing, we screen blood and organ donors, diba? Because again, that's the main mode of transmission of the virus. And initial diagnosis of symptomatic patients. And also we detect antibodies against recombinant and synthetic antigens. So recombinant meaning i-change gamay ang mga genetic compositions sa mga antigens and then i-manufacture sa lab. same as synthetic antigens. So these antigens by third generation enzyme immunoassays or chemiluminescence immunoassays. Alright, so NS meaning ano na siya? Non-structural. Okay. Non-structural ang meaning. Non-structural ang NS na meaning. Okay. Alright, ayan. So we detect either again, screening again for blood and organ donors, important, and for antibodies against HCV. Okay. Now for confirmatory method, we use what we call the RIBA. Ako batchmate siya. RIBA, recombinant immunoblot assay to detect specific HCV antibodies. That's a traditional method. So what you do is same siya with your parang Western blot. You have 3 strips, and then each of the strip na ang antigens. Nakabutang siya sa strip, and then you then overlay the strips with the serum of the patient expected to contain the HCV antibodies. So the antibodies will then bind to the antigens and then i-wash, and then imo siyang i-stain, and then of course na yung mga colored bands. And the colored bands indicate kung ano sa mga antigens na naka. Yeah, that's recombinant immunoblot assay. So mura siya Western blot. But that's traditional. Nowadays, ang confirmatory test na is through molecular methods. PCR, di ba? Ayan. So, quantitative, qualitative PCR, RT-PCR, again, most common, and transcription-mediated amplification or TMA. Now, for quantitative PCR, usually, we perform this, okay, for quantitative PCR to detect what we call your viral load. Ayan. Please take note. So we detect HCV RNA through quantitative PCR to detect viral load or the amount of your viruses in your system. Because again, the amount of HCV RNA detected using quantitative RT-PCR will now equate or is equivalent now to the viral load. Okay, so the amount of HCV RNA detected by quantitative RT-PCR is now equivalent to the viral load, meaning again, the amount of viruses in the system. Okay, and it's important to establish the viral load for treatment purposes or sa course of infection ba. Okay, so that will help your doctor decide kung sa mga next courses of action nila. Okay, and lumabas to sa boards, okay, murag HCV RNA na di ay itong ibutang, murag what is detected in the HCV RNA or the amount of HCV RNA corresponds to the viral load. Okay, please take note. Okay, alright, so ayan, so those were the first 3 hepatitis viruses, okay? And for the next video, we'll now start, ayan, with the most popular, very important, most important din, the hepatitis virus, because again, it's common in the Philippines then. So yes, we'll start now with hepatitis B in the next video, and I'll see you there. I'll see you in the next video, okay?